Doctors of Reddit, what's the biggest case of faking it you've ever seen? My cousin got glasses. Her 7-year-old little sister also wanted glasses because she thought it was so cool to wear them. So she started telling her teacher she couldn't read what was on the chalkboard, and she'd squint at home, and go incredibly close to the TV to watch things because she said she couldn't see things clearly. Her parents got worried and took her to the doctor. She read everything wrong on the vision tests. Everyone seemed convinced that she needed glasses, but the doctor was a little concerned because the tests indicated she needed really thick glasses, and usually that wasn't the case unless there was a family history of vision issues. Her parents both had 20/20 vision and her sister only had astigmatism. They all realized she was faking it, so the doctor told her parents in front of her that she'd need some pretty intense eye surgery so she'd be able to see without glasses. They even wheeled in a machine to make it convincing to say they could do the surgery right then and there. She freaked out, confessed to faking it all and started to cry. She got grounded for a while. I'm an ICO and a nurse. We get a lot of malingering in the air. One day, one of our frequent flyers came in and started faking a seizure and tridge. Now obviously I know this lady and she's fake seized a million times before. But this time it's in the lobby in front of about 30 people, who have no way of knowing that it's fake. She's lolling around on the floor making a damn fool of herself and folks look horrified. I walked up to her and said calmly, "Karen, what are you doing?" To which this genius responds, "I'm seizing." I told her to stop seizing, so she did. Edit, no, her name wasn't actually Karen. I just did that for confidentiality. Resident. On nights I had a gentleman pseudo-seizing. Really sad as this is common with PTSD and other mental health issues. Sternal rubs weren't doing anything, basically rubbing a knuckle in their chest, which we often do to wake somnolent patients but has other uses. So I'm casually talking to him, telling him what we're doing. I do this with patients that can hear me or not. Then I tell him we're going to raise him up in the bed and go to put an arm under his shoulder to move him. He looks at me and says I can do it myself, proceeds to move up in the bed, then continues his seizing. Bless his heart, I hope he gets the help he needs. Edit, yes, the bless his heart is sincere. Mental health is a drastically undertreated, not addressed aspect of our medical system, and I have great compassion for these folks. Yes, this has to be treated as a real seizure until proven otherwise in case it does happen to be real. Thanks for everyone that brought up pseudo-seizures are antiquated amnesias or psychogenic non-epileptic seizures is much more accurate, meaning not having changes in brain waves consistent with epilepsy on EEG. Also, sternal rubs are very painful and are used sparingly when it is necessary to ascertain a patient's state, when powerful interventions depend on the information we are able to rapidly acquire. Not something to be taken lightly. Anyone with NES, there are clinics that can help you. Please seek out help. There is no reason to be ashamed, though ignorance and judgment is prevalent in any field. Had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated hello wave. She started to throw her arm up but caught herself halfway through, then threw her hand back into her lap and pretended to be staring off into nothing. When I was a kid, I learned I could fake sick and get out of school. So 1-2 days a week I would get a migraine and hold my head and complain, and I would get to go home. Eventually my parents took me to a neurologist who said maybe you just don't let him eat chocolate and sugar. I admitted to faking and was grounded for a long time. When I was a kid, I would plan my sick days way ahead of time. Had an old thermos that I would pour leftover milk, meat, whatever, leave it on the windowsill in my bedroom, just letting it fester for a month. Of course the thermos was closed so no smells escaped. I set an alarm for the middle of the night, dumped the contents of the thermos on my rug and ran in to tell my dad I was throwing up and so sick. However, This thermos monstrosity filled the entire condo up with horrible smells, and both me and my dad ended up puking into the tub at the same time. Every time we tried to clean up the rug, he had to take the day off work too. Needless to say, I never pulled that again. Years ago I had a patient who had been rear-ended in an auto accident a few weeks before I saw her. She had a history of lupus. She was decked out in the usual crippled paraphernalia, crutches, neck brace, elbow braces, wrist braces, knee braces, and could barely walk. I saw her a couple of times and she showed no improvement. One Saturday I was on call but had to take a back streets route to the hospital because of an event taking place on the main thoroughfare. I apparently drove through her neighborhood, because, wonders behold, there she was wearing old lady spandex power walking down the sidewalk, holding weights in both hands. I did not call out to her. Next week, she was back in clinic, with her I am crippled get up on again. A few weeks later I got the subpoena for the deposition, and it all became clear. No doctor, but a funny story from work a couple years ago. Guy calls in sick for around 8 days, says on the phone he is really sick, comes back to work the next week, tanned as FCK. This dude hands our medical slip to the manager written in Spanish. On the slip there's an official seal from some random Cuban clinic. Guy walks over to B with a grin on his face saying, "Yeah, I'm probably fired." He was fired. Nurse for an ophthalmologist here. Had a 21-year-old new patient claiming to be completely blind from a sudden and severe glaucoma diagnosis from a previous unknown doctor. Would feel around while walking, tried to keep eyes rolled back into his head, the whole 9 yards. He said he is a famous YouTube rapper that is now unable to make videos or earn a living. I exclaimed to have heard of him before and very excitedly asked him to search and show me his YouTube channel on my phone so that I could subscribe. He took my phone out of my hand and effortlessly found the YouTube app and typed away in the search bar, "Oh," and of course his eyes were back to normal and focused. Male patient, 18 years old, rolled in unconscious. Mom says he's been like that for the past 4 hours. Go to check his lungs when I hear something interesting. I place a stethoscope near his mouth and hear him breathe in normally, but then breathe out by saying breathe. No joke. Male patient, 21 years old, admitted with inability to speak for last 2 hours and respiratory distress. Lungs clear, but we hook him up to oxygen for a few minutes. After he's taken off, his father comes running and drags me over, saying his son's tongue refuses to go back in after receiving the oxygen. I look at the kid and he's seriously just lying there with his tongue poking out like a child. I tell them to push it back in. A few hours later the dad tells me the boy is convulsing. I go to see without making my presence known and he's lying there just fine. The moment I ask the mom how he's doing, he starts convulsing. Think of an odd version of the worm, but on his back. Female patient, 16 years old, admitted with complaints of recurrent seizures and frothing from the mouth. I look at her and she is literally blowing spit bubbles. I check her reflexes, everything is intact. The moment I turn away to check on another patient, she suddenly becomes rigid and the spitting intensifies. Male patient, 30 years old, unconscious and completely unresponsive for 6 hours. This guy was totally dedicated to his act. I initially approached it as a stroke, but when the blood pressure, ECG, reflexes, pupils, etc. all are normal, I start checking pain sensation. He slowly began to open his eyes and groan as I asked him to tell me his name, but the moment his Achilles tendon was pressed, he suddenly sat up, stated his name, and declared himself cured. Female patient, 17 years old, complained of respiratory distress and convulsions. Everything's normal on admission, and she's conscious but refuses to eat. Parents are worried out of their minds, and every few minutes she has a fit where she would just basically shake from side to side. She let slip to a nurse that she didn't want to go to school that week, So she was faking an illness. Since she was refusing to eat, the attending wrote up an order for a nasogastric tube, which was inserted and then removed by her in a matter of minutes.